How do you deal with a patient who's got a brain tumor? How do you go about dealing with that situation?
Yes. Now, there are two aspects to this. I would like to say that at all times, the doctor has to be as truthful and appropriate as possible. There's no longer hiding the diagnosis from a patient. But then you have the opposite problem, which is quite fascinating, because the patient not only may have their behavior affected by the tumor, but they may not understand the information you're giving them. So you have, with the brain tumor patient, the communication may not be as with other diseases and other cancers. So one has to be aware of being truthful. Does the patient understand what I'm saying? How am I going to say it? Am I going to say it to the patient, or does the patient want their family involved immediately and get the shock with them? Or do they want to be told alone and they then tell their family? So let us assume we have got to a point, we've diagnosed a highly malignant brain tumor in an individual of 40 years old. Often they do understand, depending on their state. They may have been unconscious. So there'll be all different scenarios which we have to deal with. But this 40-year-old banker, very clued up, will ask, "What did you find, doctor? How bad is it? How long do I have to live? I know this is the end." At all times, I would say that there is the truth and there's optimism. And I'd box them together, because the doctor, in spite of knowing the statistics worldwide, nationally and internationally, can never say how well that patient's going to actually respond to treatment. Now, I want to emphasize this point emphatically because I feel so strongly. Brain tumors is one of the tumors where doctors, because of the very, very bad outlook in the past in the malignant brain tumors, would give up before even trying treatment. And this, it still exists actually, that some doctors say this is a highly malignant tumor, we're not even going to try. Fortunately, less and less, as they've seen, there's chemotherapeutic agents, radiation, surgeries become safer, particularly very large surgical procedures. So I think when one speaks to the patient at this point, one must be truthful and say emphasize the seriousness of it, but also immediately and consistently, in parallel, say to the patient what we are going to do together for them. And almost at that point in time, perhaps my point of view is an eccentric one, create, if possible, a partnership. And you're going to say to me, partnership? Are you going to a solicitor's firm or selling textiles? A partnership between the patient and the doctor to get better. So you're emphasizing the major problem, that you've got your balance sheet down in the dumps, but you've got things in your armory to get that patient well. So this is very important. This is very important. Now, the patient, there's a most extraordinary thing with patients with brain tumors, which I just like to mention, that the human condition, in fact, particularly in brain tumor patients, protects them. They are able not to have the same fear as a patient who's walking in the street without a brain tumor will dread it, like I personally dread dementia. They will think, my God, it's a brain tumor, I will die. Once the patient has the brain tumor, I've observed over many, many years that they almost have a protective element to hear the truth, to hope to get better. Now, obviously, they will go home and look at the internet and see the statistics, but for some reason, they have a certain protection evolves. Now, I've often tried to relate this protective element that they feel with the site of the tumor. Does the tumor, because it's affected the brain, it affects the brain's thinking process, but fortunately, it may not affect their process of reading and working out things, and some of them are still able to have a high-powered job. As my 40-year-old banker, he may still be able to go on working for some time, but they will have some extra ability to cope with it. Now, from the practical point of view, after discussing with the patient, the diagnosis and what can be done to the patient, him or her and their family, if necessary, the family then becomes extremely important in practically all cases if there are a family. But that's another topic again, how one will deal with the family of a brain tumor patient when the patient, in fact, may become violent or may become promiscuous or may become, there's another social aspect to it. But if we leave that alone, the family is critical. So we've now got the patient. We've told the patient what they have. We explain to the patient after a multidisciplinary meeting of neurologist, neurosurgeon, radiologist, cancer doctor, what we aim to do. We get their consent, and then we plan the initial stages of the treatment, which is usually surgery if surgery is needed. And in many cases, unfortunately, surgery cannot be performed, but in a great many cases, it can be performed. And we aim at this initial surgery to remove as much of the brain tumor as possible, leaving the patient with no severe deficit, that they can still talk, they can still walk, they can still eat, and they can still live with most elements of their life intact.
Is it very depressing? I mean, is it very depressing for the patient?
It must be devastating. It must be devastating for the patient and their families. But because the patient has had symptoms before, and sometimes to relieve these symptoms, they've been put on steroids, which is very common, cortisone-type drugs. They're already usually maybe slightly euphoric. Depression is certainly very common at this stage of diagnosis, but not invariable. They may be manic because mood and behavior is affected by this brain tumor. And one aims with all one's strength as their doctor to put them in an environment with their family, their partners, their community, their spiritual being, to cope with what's to come. Now, with all other cancers, with all other diseases, the brain, and some people are equating the brain with the soul, with all sorts of things, are not affected. So you've got this extra dimension, but this extra dimension may or may not have a depressive element. It could be a euphoric element rather than depression. And this is a whole new topic of the management of these tumors.
But do you, as someone who's specialized in brain tumors over the years, you haven't found it a very depressing experience?
It is a depressing experience, and the majority of doctors, I believe, cannot face up to managing these tumors day in and day out. Even the majority of oncologists, cancer doctors, and neurosurgeons have to be of a special type of fighting person. Yes, I found it sad. I found it often at the heart of being, of the very philosophy of being, looking at the patients, trying to understand their torments, wanting. But there's been two things which has lessened the burden. One, to do everything scientifically, ethically, medically to help and to find out more and more. And secondarily, a feeling of fighting this disease together with my team, my colleagues, my nurses. My team I include from everybody around me, from my secretary to the nurses, to the porters. And as a group, this has heartened me that they have been so supportive of me personally, so that I can be more supportive of the patient. But there always must be a therapeutic distance between the doctor and the patient and their families, because difficult decisions have to be made. And therapeutic distance is another discussion, not particularly only for brain tumor cases. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.